Okay, I'm Dr. Baharestani, an ophthalmic plastic surgeon here in Smithtown, New York. Thank you for joining us for our live Kybella demonstration. We have our patient here, Gina, who's going to receive her second Kybella treatment. She had her first treatment a little bit in the past, and we're going to be doing her second injection now. The first thing we do when we inject patients with Kybella is kind of examine the neck, and we did this for her first treatment, but just so you have an idea of what we do when you come in for a cosmetic consultation, we'll kind of go through things right now. I'm going to have Gina sit back here. So basically when we look at the neck, we want to make sure that a patient is a good candidate for Kybella treatment. Kybella gets rid of fat from underneath the neck to give a nice slimmer neckline, and she would be a great candidate for that. We want to make sure there aren't any other conditions that we might be missing, like a salivary gland that might be enlarged or a thyroid gland that might be enlarged, that obviously we don't want to treat those, we want to just treat the fat. And that's what we're going to be doing today. Gina has had her neck cleaned with an alcohol swab, and we're going to use a marking grid to point out exactly how much Kybella needs to be treated. So let's get started. So this marking grid we place on, it basically shows us how much Kybella needs to be injected into the area. This is kind of the funny part where I'm kind of strangling my patient, just holding it down. We have a wet gauze. You'll see there's going to be some dots that are going to be transferred over onto her chin, and that'll kind of guide us exactly how much needs to be treated. Okay, let's just make sure we have that on there. Okay, great. And we're going to peel that off. So you can see our grid is there, and that kind of guides us as to how much needs to be treated. So Amory, my assistant, is going to help us here. Basically, we're going to get started right now. Okay. So basically the treatment guidelines, basically we want to go from the marionette lines. Those are the lines that come down from the corners of the mouth. And I use that as a rough guideline towards the hyoid bone. That's the bone right in the middle of the neck here. And we want to treat in between each of those dots, going between the two marionette lines, going down to the hyoid bone. I usually like to start lower, and then we'll march our way up. So here comes the first treatment. Ready? Pinch the skin a little bit. Little pinch going in there. Great. And we inject about 0.2 cc's between each of these dots. The reason we go between the dots is we want to make sure there's no permanent tattooing, although it's very unlikely that that would happen. We just want to make sure that these dots actually come off at the end of the procedure. And I'm going to have you turn a little bit towards me. Great. Great, I'm going to march up here. Amory, you have that second syringe ready? Mm-hmm. Some people will pinch, some people will inject. I usually go halfway through. Okay, and I'll need another one tracing. Here we go. 1, 2, 3. Doing okay, Gina? Mm-hmm. Awesome. Doing fantastic. On a scale of 1 to 10, how you doing for pain?
2.
2? Okay, great. Sometimes people will start to feel some burning after we do the injections. That's kind of the molecule working and dissolving the fat there. Awesome, and we want to make sure we go deep enough to kind of hit the fat and we don't stay in the skin layer so it doesn't cause any necrosis. And it goes pretty quickly. We pretty much just march our way across. Amory, can I have a 4x4, please? Great. Okay, and we're going to switch out there. I'll grab that. A couple more. You're doing fantastic, Gina. Okay, 2 more injections and then we'll be done. After we're done, we're going to put some ice packs here. That's going to help keep down the swelling and take away that burning sensation. We want to stay away from the bone that's right underneath the chin there. There's a big nerve there that if it's kind of struck can affect the smile. All right, awesome. So that's it when it comes to the Kybella injections. We start to see the results over the next few days to weeks as the swelling goes down, and then we can determine how many more treatments we want to do. Generally, patients will need anywhere from 2 to 4 treatments to achieve the maximum result, and the results are permanent. We're going to follow up with Gina in a couple days just to make sure we've achieved exactly what she wanted and make sure she doesn't have any significant swelling or any trouble after the procedure. And that's about it. We'll see each other again in a month to see if we want to do more treatments and take it from there. So thank you so much for joining us here at North Shore Eye Care. We offer complimentary cosmetic consultations in offices all throughout Long Island, Garden City, Smithtown, and Riverhead. Don't hesitate to call us in the office to schedule that consultation for either Kybella, Botox, Juvederm, Chemicalpeels, or other facial treatments. And obviously we do ophthalmic plastic surgery, which is cosmetic and reconstructive surgery around the eyelids. We'd love to see you in the office. Thanks for joining us tonight.